hold on. And you first put your oxygen mask on yourself, and then you help others. It's the same if someone is drowning. You know, see to that you have your own lifeguard on, your own life vest, and that you can swim, so you can help others. So it's not only we're not only entitled to protection. It's our professional duty to see to that we are protected and our well-being. And this is important because when you are out there in the emergency room by yourself, 2 o'clock at night, you have to be very confident in that we all stand behind you. And that is one of my duties as leaders now. I say that. I tell all my students and my employees that, so they know that they can tell the rest that, I have to see to myself. Healthcare then, this is the year of the healthcare worker. And I can say healthcare is one of the pillars in a society. A well-working economy, a well-working labor market, a well-working educational system, and a well-functioning healthcare system. These are the pillars for a working society. So it's actually a no-brainer that healthcare and healthcare personnel should be have their own role and be protected. That's the start. So now I'm going to talk a little bit about this, and I have some slides. I really hope it will work with share screen here from Stockholm. To do this one, okay. Share. So that was a little bit wrong. I clicked the wrong, I think.
Ma'am, we can see the slides.
Can you see the slides?
Yes, ma'am.
Okay. So here, okay. So healthcare and physicians' health, they do not come by themselves. They need active handling to thrive and be healthy themselves. And let's see, whoops, threats they face. So I hope this is the right one. Otherwise, yeah. So the year of the healthcare worker is, and the actions are built on the global strategy on human resources for health that WHO made 2016 actually, and it's supposed to be implemented by 2030. And here it is, if you want to read it out or download it later. Oops. So, and here is, you can say that these are divided into 7 areas, and I'm going to speak a little bit more about some of them and a little bit less about others. It's about threats and violence. Unfortunately, that's one of the bigger problems in the world. It's not, and physicians today, they're not only facing the frustration of the patients, but they're also being many times in a very difficult situation in their own countries if they treat patients that are part of the opposition, political opposition, for example, and even being targets in danger. We see that more and more often with healthcare personnel who describe how they're being attacked actively during conflicts. And of course, if you want to hurt your someone else and you're in war, you strike against infrastructure, and healthcare is infrastructure. And what is healthcare? Healthcare is people. Then cyber compromise has flown up as a big one. We are more and more attacked by cyber attacks, and sometimes they hit towards physicians. We have seen that the number of attacks towards physicians' email accounts has increased rapidly, not at least during the pandemic. Labor shortages is a big one, a big problem, and if we should continue the way we do today, whole classes of pupils need to go into healthcare. And that won't hold. So we need new techniques to help us and the patients. Otherwise, we will have a permanent labor shortage. Well, we do have a permanent labor shortage. McDonald's medicine. Well, so the topic for today was both India, Sweden, international, and this is not in all countries, but in some countries there is this problem with consumerism. Occupational health hazard is maybe the biggest one. It's also one that is in our power to change because we are in leadership as well. And here, Rice. So if you can hear me, please go into leadership. Go into science as well, but leadership is so important. Planetary sustainability, yeah, we take care of the effects of the bad bad water conditions, the pollution, bad air, and so on, and burnout. Burnout is a real big problem for us. So the WMA has made a WMA statement on physician well-being. And that our statement refers to the optimization of factors that are important for a sustainable work life. It's not only psychological, but it's also social and prevention. And also prevent doctors from exposure to viruses, of course, other diseases, but also gases and everything else that we are exposed to and in our work, and also burnout, of course. And this counts for everyone from the day we start our medical education and until, well, we stop working. We don't stop working when we retire. As a physician, you are physicians your whole life. You don't, well, you work as physicians, but you are physicians. And you will be seen as physicians and doctors in the whole society, if you're employed in a clinic or if you're just walking on the street or you are somewhere. Many of you will be asked to help in other situations, and you're physicians. So all physicians and medical students in every career stage are exposed to both positive experiences, because there are a lot of positive experiences. And I believe that during my time on the expert panel for life science, I have seen many examples on Indian initiatives that are very exciting when it comes to new techniques. So it's there are many positive sides and positive experiences as well. But there are a variety of stressors and work injuries there will be. And the medical profession should seek to identify and revise policies and practices that contribute to these stressors. And we need to collaborate with the NMAs in order to develop policies and practices that have protective effects. And I know the Indian Medical Association is very active on this, but it's not easy. I know I have led a National Medical Association as well, and it's constantly standing up and approaching the government. But that is our task to do as leaders. And I think it's impressive what you have been doing. So, like all human beings, physicians experience illnesses, and we should also have the ability to fulfill our family obligations and other commitments outside the professional life. These needs to be taken in account. So you see here, what is the professional individual? It's a lot of responsibility. And let's see here. We also have, we are highly driven individuals. I probably know yourself, high achievers and a high sense of duty. And we are successfully completing the long and intense education. Well, that will continue, I can assure you. It will never end. And the requirements often confers upon physicians a high degree of respect and responsibility. And the responsibility can be heavy to carry. And there is a direct relationship between physicians and patients' preventive health practices as well. This relationship should encourage healthcare systems to better support and evaluate the effects on patients of improving physician and medical students' health. We do revisions in my hospital. We've just had one, and they have found out that the medical students' spaces, they're not good enough, so we will have to improve there. Revisions are good. And I should also point that physicians are often perceived as being immune to injury and diseases as they care for the patients. And workplace health and safety programs might be overlooked many times. And the pandemic has shown us that we are not protected. So I'll just swap my picture. So I'm going straight into threats and violence, because that was also addressed in the WHO document. And I have said something about it, but there are not only single cases, there are thousands of threats, violence towards healthcare personnel in the pandemic. There's been more than 1,000 attacks and threats of violence against healthcare workers only in 2020. And it continues. We have had a number of threats. And in December this year, we were out and made a statement towards a government. It was Turkey. We have been out towards Turkey earlier as well and protested. There's been Belarus. There's been a number of other countries where governments have attacked healthcare workers. But there is also, in general, it's global. It's here in Sweden. It's in India. It's in Africa. It's in the US. Researchers found that at least 400 related in some way to COVID-19. And a lot of people are stressed, but they also afraid. The population are afraid, and we are in front line. We have many students that have been in front line in the world, and they have done a fantastic job, but many times they have been overlooked, and their security has not been secured. In India alone, more than 150 incidents were reported, a large portion which involved violence against healthcare workers and their families. Yeah. And I mentioned one here, in September, a community in September district, and there was an incident, and where an ambulance carrying a suspected COVID-19 patient were chased, and people were carrying sticks and throwing stones at the vehicle. And we get in the front line. And before the pandemic reached India, that was in California, in Berkeley, actually. The Human Rights Center found that between January and December 2020, I believe it was, there were more than 1,100 attacks globally against, also physical attacks against medical personnel, and also through against their patients while they were trying to handle the COVID pandemic, and also towards facilities and medical transport, and also the fear among people. People were afraid. Okay, so it's time to take action. I've looked into or followed the Indian Medical Association. It's an impressive organization, and they've demanded legislation and demanded a police workforce to protect health facilities and doctors after they've been threatened. And in April, I believe it was, there was a violence against healthcare workers and a non-available offense punishing for threatening healthcare workers. And we have had as well in the rest of the world quite heavy sanctions when healthcare workers have been attacked, which is good. We have also had the WHO have tried to have checklists for leaders to have work systematically to protect healthcare workers. And also Sudan created a police force to help and protect healthcare workers. And the International Committee of Red Cross, I put it up here since I find it good that it's been so unified, the actions to protect healthcare workers. So, and here you see there were 611 incidents recorded by the Red Cross catalog, but it's probably, that's just the top of the iceberg. But they are physical assaults, fear-based discrimination. People are afraid of healthcare workers. Many healthcare workers described how they were excluded in society because people were afraid that they were infected by COVID-19. Then we had a lot of verbal assaults and threats. And so here's also the situation. We know that healthcare workers get in this situation. Of course, there's a no-brainer that we are at high risk of being infected. We are exposed to viruses and other agents. So therefore, having a good legislation preventing that, that's fine. But we need to have vaccines. We need to vaccinate the health workers because it's crucial. You work with this, and it's not only the COVID-19 vaccine, of course. There are other vaccines against hepatitis, for example, should be provided to all healthcare workers and all students. Of course, we do that here in my hospital, and feels good. Okay, so I think you might have seen this one. There's an Indian church that hails COVID-19 law, punishing assaults on healthcare workers. And it's a protection. It's good, again, because people know that if they attack healthcare workers, there will be consequences. But of course, we should prevent it instead, so that healthcare workers should not be attacked. Okay, I mentioned cyber compromise. I'm not going to speak a lot about that, but it is a fast-growing threat because healthcare workers, we have a lot of knowledge and we have access to healthcare records. We have access to patients, and thereby we are targets. And during the pandemic, there have been multiple targets. I don't know about you, but we have. I've had multiple attacks on my email accounts and other access accounts. I think you might have experienced the same. And malicious network traffic, 72%, and our healthcare organization are affected about this. Here we have had a couple of incidents where the whole healthcare record of hospitals have gone down. We have had other attacks where the electronic prescription system has gone down, and physicians stand there and they can't get these prescriptions out for their patients. They can't see they can't get any information about the patients. That's the other side of the coin. When you have so much a digital system, you're very vulnerable. Phishing, 56%. So we see as healthcare workers and students. And why students? Well, students are very often engaged in science and research. You have access to academy. That's why you are interested as individuals. And operating system, vulnerable operating system. Yes, we are vulnerable in our operating system. So see that you have a backup and multiple backups of your work that you do. Then I found the man-in-the-middle attack. Some students have been tracked to give out information. They have thought they have been communicating with their worker, employer, but there has been someone else attacking them. And then they have been gotten problems because of that. So it's difficult and stressful trying to keep track of all these cyber threats and still try to care for our patients, one physician said. I keep a lot of my time finding the right information, and if I put in the wrong information, I will carry the responsibility, not the organization providing the system. I will carry the responsibility myself. And we are not educated on online risks. So some healthcare information needs to be shared, and but not at the cost of us and the patients, of course. Then the labor shortage, and here I guess you have experienced that already. We have a lot of students working in our organization. They are so valuable, and that's the way to recruit them as well. That's how we educate also. But there is a shortage of healthcare workers, and it's very important that we don't see physicians and students as owned by by the state or by anyone. It's a free profession. You are free as individuals. You make your own decisions, and you should be able to be in a labor market and own your knowledge and your life. Many young doctors describe how they are more or less owned by the hospitals. They move into the hospitals and they work so many hours. And that's because we have a shortage of labor. But the solution cannot be that we do again dedicate our life to humanity, but there needs to be reasonable conditions. So by 2030, the World Health Organization projects a worldwide workforce shortfall of about 18 million healthcare workers. It's a huge number, and we will not be able to carry it alone. We need help, support, finances, resources. We need new technology and so on. The quadruple aim is it's the better health, better care experience, better value. And the fourth objective is better well-being for healthcare providers. And it's extremely important, and it's not a one country problem, it's a worldwide global problem. And where we have limited resources, and the report describes areas with limited resources, but I can see that in the whole world described in different ways. And even in Sweden, we have corridor patients here. People in my emergency room here, patients have been waiting for 20 hours to get in. It's full. It's full. So it's a tough one. And here, addressing the pipeline of workers, of course, what is that? Yeah, we have been talking about the pipeline of workers. That means education, preparing for work life, going to work life and work a whole life. And that means education, training, and well-working organizations. And it's a leadership issue. We work a lot, but to have reasonable conditions, that's a leadership issue. And we are leaders, so you need to be managing directors. You need to take over after me. So, and if we don't address this now, there will be a very shortage of healthcare. We have had in the world problems with educational systems as well, educational institutions. And some educational students, all the teachers have left. We cannot leave as physicians, but we have to take care of ourselves. And here I've cited Anupkara. India needs to invest in HRH, as human resources, to increase the number of active health workers and also improve the skill mix, which requires investment in professional colleges and technical education. You have great education and universities, but they are not running without new resources and techniques in education. I can tell you in Finland, almost 1/3 of the medical students plan to go into medical technology, life science. So I predict that many of you are going to do a journey like that, because physicians are needed in life science and medical technology as well. And India also needs encouraging qualified health professionals to join the labor markets, and additional trainings and skill building for already working but inadequately qualified health workers. And it's not because they're inadequate qualified, I would say. It's just that with new techniques coming in, they need to get a chance to be educated on new technique as well. And sometimes new techniques are there, but they are not implemented and not invested in, and investments is one of the most important things. So mental well-being for health professional is important, and of course this is the year of the health care professional 2021, but it did not start this year. We did not come up with a need to look after the healthcare personnel 2021. So a couple of years ago, no, 3 years ago, we started a collaboration between our organization, World Medical Association, the Nurses Organization, the Physiotherapist Organization in the world, and so on. And we made this this report, Mental Wellbeing for Health Professionals is important, ... And we are describing why. There is a clear relationship between the well-being of the physician and the care for the patients. Maybe a no-brainer, but it needed to be stated, it needed to be written down. And and WMA has, we have a policy, as I referred to, the healthcare policy statement on physicians' well-being. I'm just going to quote two things that I find important for you. We say that in partnership with medical schools and workplaces, NMAs recognize as a national member of associations, recognize their obligation to provide education at all levels about physician well-being. NMAs should collaboratively promote research to establish best practices that promote physician health and to determine the impact of physician well-being on patient care. It's also, we also state that strong and consistent link between physicians and patients' personal health practices, providing yet another critically important reason for the healthcare system to promote physician health. Physician health is one of the biggest issue in the world at the moment, and will be 2021 and 2022, 2023. When it comes to burnout, between May 28 and October 1, 2020, there were 20,947 healthcare workers that responded from 42 organizations that were in an inquiry. And in this report, they reported 60% fear of exposure or transmission, COVID-19. And they reported high numbers of anxiety and depression. I can say we have our own study going here in Karolinska Hospital, and we see the same numbers in our hospital as in this global one. So we can say fairly, they were high numbers, 61%, but yes, 38. We have around 36%, but still it's a high one because it's we actually see PTSD, post-traumatic distress syndrome, in our doctors and nurses. 43% suffered work overload, and almost every second burnout. And 30% of nurses are reporting risk of leaving. I've been hospital CEO this week, and nurses here, they carry their assignment papers in their pockets. I'm not kidding, because it's so tough. They've been working and working through the whole pandemic, and now they are tired. And they don't see an end to it. And now we have had the highest numbers in Northern Europe, so we didn't do very well. We have actually have delegations here from the rest of the world to look, because we have had so many patients in both COVID and also post-COVID. I'm chief of the department of post-COVID, so I don't know. I would rather show them something very, very nice and very successful than that. But okay, we have doctors on 48-hour shifts, and it's not only in India, but I'm concerned, 48-hour shifts. I can tell when I started my career, I'm not that old actually, but then I heard about, then when I was a young doctor, my senior doctors told me when I was young, I would work 48 hours. You only have to work 24 hours. And I thought, you know, okay, I was quite impressed. But at that time, when they were young, the hospital gates would close at 10 o'clock in the evening, and there would be much lower pressure. Today, it's like patients are coming in, and it's very high demands. And 48-hour shift in the situation you have, that's not good. And it's also underfunded when we look at the funding. I'm going to show you a picture of that. It is underfunded. And what we see, and WHO has shown this, that every country where the economy is doing a little bit better, they invest more of GDP in healthcare. And these are intertwined. It's not that they invest more in healthcare just because they have more money. It is because to develop the society, you have to invest more in healthcare. So you have 3.54 of GDP in healthcare. That's too low. Well, as a physician, we almost say, well, I feel like it's too low. Or there are signs of that it's too low, but I would say it's low. Okay, here we see burnout risks in different healthcare workers. I just want to say we are not alone in this, and but our numbers are rising. We have always had low numbers. Physicians were never ill. Physicians take care of themselves and so on. And here on the right side, you see physicians. We are still quite low when it comes to burnout, but this number is rising and will rise in the future. And it's, as a leader and being in healthcare for 20 years, it's not, you are coming into a healthcare system that is it's a quite tough career. It's a fantastic career, but we need to work together to take care of each other. And physicians have not been good. We have been good in teaching students medical knowledge, but we have not a history of taking care of each other. That needs to improve. We see burnout amongst other healthcare workers. Social workers are high. We see numbers that they are rising now as well. Medical assistants, the same. Okay, burnout, depression increases among Indian healthcare workers in the COVID crisis, as in the rest of the world. But more than 1,100 Indian doctors have lost their lives so far. And there are many more around the world. It's chronic underfunded, and I've taken it out here. But before the pandemic, the Indian healthcare sector was ranked 110 out of 141 countries, and even after Bangladesh, Indonesia, Chile. And this is from the World Economic Forum Global Competitiveness Report 2019. And then you can say, despite this, India is one of the very impressive nations when it comes to life science, technology, but it also need funding. People do not work without funding and payments. I met a nurse here who said, I'm very happy that you tell me that I'm good and you pat my shoulder, but I'd like to have paid as well. That was here in Sweden, and she had an extra shift and had to stay without payment in the hospital. And the infrastructure, the health infrastructure is bad. We have heard reports of patients that get very heavy hospital bills after being treated for COVID-19. And we know that if we have a healthcare system that is founded for everyone, that's good for the population. So to take good care of the population, have a well-working system, we need funding. And personal losses. In the pandemic, both for the physicians and the patients. And we often stand there. We are carrying the patients on our back. Oh, McDonald's medicine. I'm not going to say much about this, but it's a consumerism. We have a debate in the world what to prioritize, and their personal choice. Healthcare is a global big industry as well. And there's a cultural push. Many physicians around the world describe this. Quick, cheap, easy, customer always right. We have fines. We have also in Australia and in the US and in some European countries where doctors are being lawsuited for money and so on. So that's a tough one for many doctors in the world. Occupational health threats. I have to say something about that. High threat of COVID-19. Yeah, we are exposed not only to COVID-19 and Delta. There's HIV, there's hepatitis, Ebola, and other needle sticks. We have also violent patients. We have ergonomic hazards. In many other sectors, they work to and develop and also invest in better facilities for ergonomics, lifting, but not in healthcare. Healthcare has been caring. People working with people. We also need a better system. Chemical exposure, anesthetic gases, lots of anesthetic gases. I think nitrous oxide is 300 times as well, poisonous or dangerous than the CO2. So it's tough. Chemical exposure, healthcare, and we need protection, just as we need protection masks. Here, I would like to say something healthcare in danger as well. We have two declaration and also a resolution that we use a lot. Unfortunately, that we have needed to use a lot. There are two things here. In the WMA Declaration on the Protection of Healthcare Workers in Situation of Violence, there is the protection, and there's also a UN agreement that healthcare personnel should be neutral in every conflict. But today, well, healthcare is part of infrastructure, and if infrastructure is being attacked and healthcare workers are increasingly under attack, we have addressed and stated that to many countries and leaders around the world, but it still keeps happening and it's increasing. And the other thing is the attack on their own population's healthcare workers, both in Belarus, as you see here, with the doctor holding up their hands. That's in Belarus when they are demonstrating. Then there's a policeman there filming them. And so the healthcare workers around the world are attacked by their own governments and by their own system. And down here, there are what's his name? I've forgotten his name, but the doctor you see down left is from Turkey, and he was imprisoned. He was imprisoned because he gave medical help to a patient that was member in an opposition group in the politics, and he has been imprisoned. And also down there is from Myanmar, where healthcare personnel are being attacked, healthcare personnel that help their own patients. So, okay, I was just going to say something. I mentioned climate and the stress. Okay, so here you see the rise of the temperature. Here is the rise of the CO2 atmospheric concentration. Here is the rise of the population. Here is the rise of the global methane levels, and here's the rise of the nitrogen flux. Here's the rise of the ozone depletion, ozone layer, natural climate disaster, biodiversity loss. When we got COVID-19 vaccination so fast this year, that was based on science from biology, mRNA. And the resource community and science community in the world could work so hard because we had knowledge about biology, and the knowledge come from nature. But we have a very rapid biodiversity loss, and that's gonna be a very bad for us when the biodiversity goes down, as it does at the moment in the planet. And okay, this natural phenomenon, are they our responsibility? Well, it is our responsibility to address this thing. If we only look to the air quality in our cities, that's bad, and we cannot help the patient. Well, we can help the individual patient at the moment, but we should work upstream towards the politicians so that they have better technology to prevent more, because we will not be able to help everyone. Okay, building knowledge. We are contributing to medical expertise, and this is only a brief one. What WMA does, we are contributing with medical knowledge and participating in different studies. Let's say here. You see India in the middle. So country spending on healthcare as percent of gross domestic product. India in the middle, 3.5%. And so you can see, well, US is a lot, of course, 16.9. But you see an average Europe, 10% about there. And also interesting here is India, 9.3 doctors per 10,000 people. That's low. You will have to be many more. And I hope they take care of every medical student who can be. Okay. Here is also nurses in New Delhi, I read, went on strike in December to force government to run facilities to pay salaries and to have more investments. And I also read that the India Institute of Medicine Sciences have paid 3 months worth of salaries that they owned to the workers. That was good. But we do what we can, and healthcare workers all over the world have been trying to fix things and help with lacking equipment. Okay, International Year of Healthcare Workers. Now I'm going to say something about that, and I'm going directly to this because the time's a little bit running. You have to tell me, Salman, if I need to quit. Okay. Oh, good. Okay, so why is this year the International Year of the Healthcare Worker? As I mentioned, it's not you, but it is needed now more than ever. It has been shown that we cannot manage without a working healthcare system. And healthcare system, what is that? Healthcare workers. And it has been designated this year in appreciation and gratitude, which is nice. Thank you for that. But we need investments as well. And we get it for our unwavering dedication in the fight against the COVID-19 pandemic, and to highlight the key role for human resources for health in society's ability to care for the health of its citizens at a global level. We will not have any well-working healthcare system if we don't take care of the healthcare workers. And the 3 key words they have: protect, good. I would say also see to prevent that is not happening, but protect, okay, invest, and together. Yeah, we work together. That's nothing new for us, but it's good. So here we go. We take care of each other. In healthcare facilities, there have been students, residents, chiefs, leaders working together, and we have worked a lot together, but it has been tough. So what are the campaign objectives of the World Health Organization? So the objectives are to ensure world's health and care workers are prioritized for the COVID-19 vaccine in the first 100 days of 2021. There was a lot of talk about this. I think it was very important, extremely important. And as the nurse told me, don't just clap my shoulder, show me it in specific actions. This is important, and I believe that we have to continue. Maybe we need a 3rd vaccine, and maybe healthcare workers and students in healthcare need to be first in line for that. Recognize and commemorate all health and care workers who have lost their lives during the pandemic. They have to be recognized, just like we do in other big catastrophes. Mobilize commitments from member state, international financing institutions, and this is important, bilateral and philanthropic partners to protect and invest in healthcare workers. So you have to invest in healthcare workers, invest in new technology, in science, but we need to invest in healthcare workers. And also the 4th one is to engage member states and relevant stakeholders in dialogue on a care compact to protect health and care workers' rights. Because it's not about only the vaccine, it's of course their rights. They are not a property of the state or the property of the hospital, because the moment you see them as that, their motivation going to fall. We need to be free as professions. That's so important when we work as we do. We have decent work conditions, and also our facilities need to be decent. I have seen so many examples of bad work conditions during the pandemic, and it's not something we solve over the day, but a good work environment is crucial. And then also bring together communities and influencer political and social support and solidarity, advocacy and care for health and care workers. Okay, that's a long one. And why I've been thinking a lot about this. Do you know how long after a crisis that there is awareness and willingness to change? Awareness of the crisis and willingness to make change. Anyone? Well, since I'm only speaking and time is running, I'm going to tell you something between 3 and 4 months. Okay, so if you see something that needs to be changed in India, and it needs to be changed when the pandemic is over, then you have a short time. And I've been thinking a lot about this because we need to decide what we want to change. And I think the working condition is a major thing to do. So here, if you want the link, I've provided the slides also. This is the link to the WHO report, because they are addressing some of the issues which I find important, and also the overall goal of the strategy, improve health, social and economic development. There is no chance we can improve the economic development of a society if we don't invest in healthcare. This is a vision. I've just put it up here, but I find it, you can download it and look it up and use it. Going to medical students. So the students is our future. That's the truth. I have students here and they have done an amazing job, and I'm gonna hand over to them in the future many tasks very soon. What we forget is that we need to make them stay in healthcare. I see so many students now that say that, okay, I'm going to healthcare. I've been here a couple of years, but actually, I think I'm gonna go and do something else. That is of course good, and many students or young doctors will go into life science and healthcare, but we need to make the clinics good enough when it comes to conditions to stay. We also need a multi-generational solution. And what is that? Yeah, it's about keeping all the doctors online, making it possible to stay and work a whole life and take care of each other. And we must recruit the best and brightest. Yeah, we actually recruit the best and the brightest. We just have to take care of them better than we have been doing historically. I think to get the materials that we get into our clinics and just put them in the ER and ask them 10 years later if they have any suggestions for improvements, that's just such a waste. We have to bring them in much earlier in decision making. You have a lot of medical colleges. I knew that before. I've been looking into that, and very many students. So you are a strong group, and together you are strong. Okay, I'm soon finished. So how can we prevent a future pandemic? Well, the best time is now, because now we have an awareness. And there are a lot of countries in the Western Pacific that have national plans for pandemic preparedness. So, and if you recall that I say that the awareness and willingness to change is the window of opportunity is very narrow afterwards. We should actually start now. And also because now the possibility to make changes are, well, they're pretty good right now. We also have the WHO Health Emergency Program that is rolling. and where stronger countries help other countries in the capacity. And viruses are global. Healthcare is global. So no one is safe before everyone is safe. That's why programs should be global. And we also need to mitigate the risk and lower the risk for other diseases. We see quite a few other diseases rise. We see increased problems with tuberculosis. We see a lack of other vaccination programs because of the pandemic and so on. And that's a big threat. So we need to work on that and work on better health decision making and response fast. So I'm going to go through that. So on behalf of the World Medical Association and as a fellow physician, I want to thank you. Thank you for your work. You're impressive. I've followed your programs through the year. And thanks to all the medical students. I know you work long hours, are very dedicated, and we will not manage without each other. I think you're great inspiration and very professional. So thank you. So questions. I'm gonna stop sharing. I think I managed to stop sharing. So thank you.
Thank you so much, ma'am, for such an insightful presentation and an eye-opening presentation. And as you rightly said, it's super urgent and very important to take action to protect healthcare workers and improve their protection, working conditions, and trainings. And the take-home message being that we, the students, are the future, and a multi-generational approach is important to solve problems. So thank you so much for highlighting such important points through your presentation. And I have the floor open for the question and answers. So I already see an influx of questions in the chat box, and others, please feel free to drop in questions if you want. So the first question is, how can medical institutions directly and actively attempt to help during a pandemic, given their wide resources in the form of students, hospitals, etc.?
So I believe strongly that the academic institutions have to push the hospitals to secure students with vaccines, COVID vaccines, but also other vaccines. It's very specific. And if the students' organization can have a good dialogue with the institutions and they together can push the hospitals, that's important because they provide vaccines, and the individual student will have difficulties with that. And also, I believe we should have revisions that go through and look at the student situation out in the clinic. We have had that now this year. It was very interesting. They would come to me as a manager and say, hey, the desks over there in section 5, they were not there. So.
Thank you so much, ma'am, for answering this question. We have another one that asks, COVID-19 has gravely affected the development towards our sustainable development goals. How do you think we can return to those efforts post-pandemic?
Oh, very good question. Excellent. So it's a fight about the where we invest the resources. W may have seen this problem. So when the G20 had their last meeting, we addressed them and addressed the issue that we need to think smart so that investments to get the economy started should be towards a sustainable society. Because if every government now run to get industry going and economy going and say, okay, we take this as an excuse for just going for the easy money and pushing sustainability away, we were afraid that would just fall behind and we would stand there and try to take care of things afterwards. So yes, addressing leaders to say sustainability and not give them the opportunity to say that they are separated because we see all the consequences, the heavy rain, the rising number of catastrophes, and all of these, they come into our emergency room. They affect the population, and we are supposed to take care of it, whilst it should have been taken care of upstreams, so that it would be better, no air pollution, and so on. Mm-hmm.
Thank you so much, ma'am. We'll take one more question. And it's so sad to just choose one question amongst the innumerable ones that are flowing in the chat box right now. So this question is about the healthcare workers facing an issue of lack of representation in government bodies, and also due to importance of job, protests are a difficult thing for them to carry out. So what could be done to see it if to see it that they are not facing workload abuse and hostile environment, especially after during the recent COVID-19 times? And in what way should they make the people in power hear them?
So I have seen some countries where the doctors and students have addressed the government to make national inquiries, to make new suggestions. And because when we address that and suggest that, we also put in that we should be on the board and we should be in the inquiry. So we need a seat by the table. And I believe there should be a seat for the National Medical Association, and they should claim a seat for the Medical Students Organization. So you will have two seats by the table. That is so important that we get access to decision making, both inquiries, advisory boards, and so on. Because if I only spend my time on running fast in the emergency room, I'm an anesthesiologist, so I have worked with COVID-19 in the intensive care. That was necessary, but I had to step out, even if they needed me, because I needed to go to the government and put myself down by the table. So physicians and medical students need to be in there for decision making. They will not only, even if they're good-hearted, make the best decisions for us. They need us. Trust is good, but being present is very good.
Thank you so much, ma'am. And I guess if you can take the last question from the audience, that would be great, because I feel really bad to not address so many questions in the chat box already. So the last question is that COVID-19 pandemic has affected a lot in the education sector, including the medical education itself. So how do you think we should overcome the loss, be it in the time or the quality of education?
Oh, very good one. We all face that problem. And so, of course, we have a depth. We need to do more of the educational things next year that we have not been doing, parallel that we are doing more healthcare that we have not been doing either. I do think, though, that we shall say we have experienced something as students that no one else have experienced in 100 years and will not experience in the next 100 years, and add that as an educational task. And my students claim, and I support them in that, we recognize their work as a part of the education, because this is needed. And knowledge about how to handle a pandemic is needed knowledge. Okay, then we should classify that and say, okay, according to the program, you were supposed to be in the ward of internal medicine, but maybe we can recognize your work as in the pandemic as equal. So that's important. That's the one thing. And the second one is that, and we know, see to that the students get their courses and online or done, just like we need to do more cancer surgery that we have not been doing. We also see that in the specialist training that they are lacking. But then I think so those three things.
All right. Thank you so much, ma'am, for addressing.
Thank you. Thank you.
Thank you, ma'am. So with this, we can officially close the Q&A round and also move towards the conclusion of the webinar. So on behalf of
I
medical
take a photo of
students,
you as well. I didn't realize.
thank you so much, ma'am. So on behalf of Medical Students Association of India, I'd like to express our deepest gratitude for you to taking the time to join, and it's been a pleasure to have you with us and celebrating the International Year of Health and Care Workers with us. So thank you so much, ma'am, for taking out the time and joining us.
Thank you. Thank you.
And with this,
maybe we can do another one next year.
Yes, I'm sure. And
Okay.
with this, yes. Thank you, ma'am.
Have a nice evening.
Thank you so much, everyone, for joining the webinar. And with this, we conclude our webinar. I'll be circulating the post-event form in the chat box right now, and I will keep the link open for another 15 to 20 minutes so that you can revisit the chat window and fill the post-webinar form as well. So thank you so much for joining again. Have a wonderful evening and wonderful night.